Hi everyone, welcome to McMaster's Demystifying Medicine series. Today we will be demystifying medical assistance in dying. Many of you may be wondering, well, what exactly is medical assistance in dying? This is an umbrella term used for the procedure in which a physician aids a patient either directly or indirectly in the process of dying. There are two forms of medical assisted death. The first one is euthanasia, in which the eligible patient receives a lethal injection from the physician, resulting in death of the patient. The second method is physician-assisted suicide, in which the physician provides the patient with medication to self-administer that results in death. In Canada, there are multiple criteria that a patient must meet in order to be considered eligible for medical assisted death. Firstly, the patient must be 18 years of age or over. They must also provide informed consent on their decision. They must also have an incurable illness. They must also have the capacity to make decisions. And they must also provide a voluntary request. From a global perspective, medical assistance in dying has been legalized in Canada, some states in the USA, Switzerland, Austria, Belgium, Germany, Luxembourg, Spain, the Netherlands, New Zealand, Portugal, Australia, and Colombia. However, in Austria, Switzerland, the United States, and Portugal, only self-administration or physician-assisted death is legal. With medical assistance in dying becoming a relatively new topic in Canada, many different myths or misconceptions have come about. Myth number 1. Many individuals believe that mature minors will be eligible for medical assistance in dying. However, that is false. One must be over the age of 18 to receive medical assistance in dying, and that age is going to remain intact. Myth number 2. Due to the recent legalization of medical assistance in dying for individuals suffering from mental disorders, there's a misconception that this will be available for individuals suffering from depression or considering suicide. This is also false. A rigorous criteria must be met in order to receive medical assistance in dying, which also applies to individuals with mental disorders. The assessments that determine whether a patient is eligible are also conducted on a case-by-case basis. The patient must have also exhausted other methods to alleviate their psychological pain, including counseling services, mental health support services, and palliative care. Myth number 3. Clinicians are inappropriately recommending medical assistance in dying to patients who are not eligible or as an alternative treatment. This is also false. Clinicians are regulated in each province by those who mandate public protection to ensure they adhere to regulation and practice standards. Those that fail to comply risk losing their practicing license or face the possibility of prosecution. Nurse practitioners, as well as physicians that are involved in the care of the patient, are able to initiate discussions about medical assistance in dying, as well as other options that are available to those patients that are eligible. With such a controversial and novel topic, there comes concern with whether the process is considered ethical or not. The biggest ethical concern against medical assistance in dying is this considered murder? When considering the ethics of this situation, a few of the bioethical principles are also considered. Firstly, it is seen that by participating in medical assistance in dying, the physician is fulfilling their duty of beneficence, which is that they perform acts that are beneficial to others. They also complete their obligations of non-maleficence, which is that they must not cause unnecessary pain and suffering to an individual. And finally, the ethical principle of autonomy is also analyzed, which states that an individual has the right for self-determination given that they have the capacity to do so. To provide you with a deeper understanding on the process of medical assistance in dying, let's go over a real-life example. This is Lloyd. He unfortunately suffered from many medical hardships, including multiple joint replacements, heart problems, and many strokes, which contributed to his poor quality of life. Although his mind remained intact, his body was giving up on him. Insisting on maintaining his dignity in his last moments, he opted for medical assistance in dying. The staff asked the patient multiple times if he was positive that this was the path he wished to take, including on the day of. The family, as well as the patient's questions, were answered. The patient then received an injection and passed peacefully with his family by his side. This is just one of many experiences with medical assistance in dying. Again, this is a process that rigorous criterion is required to be met in order to be considered eligible. This procedure is also used as a last resort when other methods have been exhausted. To To summarize this video, we first went over the difference between euthanasia and assisted suicide. We then went over the eligibility for medical assistance in death in Canada. We then debunked myths, went over ethical concerns, and ended off with a real-life example.